Hello, I'm Arlind. I'm one of the osteopaths here, and we're here today to discuss about knee pain and knee problems. So if you're here today, it's probably because you've been suffering from knee pain for the best part of a few years. You've either been suggested surgery and you want to avoid it, or the pain is extremely bad and you want to be out of pain. We're going to be discussing that today, what the causes of knee pain is and how we can potentially help you out. So, if you've been sick and tired of suffering with knee pain, let's try and find out what the causes are. If you've tried physiotherapy, you've tried hydrotherapy, you've tried cortisone injections, you've given it the whole lot and still haven't had success, let's find out and dig a little bit deeper what the causes are. So, the knee itself is a simplistic yet complex joint. Now, it's a hinge joint, so it hinges on one pivot point. It's a weight-bearing joint, so there's going to be a lot of stress and pressure going through it. The beauty of the knee is made up of a lot of different segments, and those are typically the segments and the structures that cause the pain. So you have things like tendons, things like ligaments, the meniscus, the cartilage. You've got all these different type of structures that could be leading and complicating the knee pain via inflammation. So we want to assess these different structures and find out which one is going to be the most precise structure giving you that pain. And we want to try and delve a bit deeper into that. So there's three main areas that can actually cause knee pain or bring knee pain on: ligaments, cartilage, tendons, and soft tissue. So we're going to discuss the ligaments firstly. There's a few main ligaments into the knee. You've got ligaments on the inside, you've got ligaments on the outside, you've even got ligaments intracapsule, so right in the middle there. Typically, these ligaments can cause a lot of irritation, a lot of pain, especially if you've been having it chronically. If you've got an injury where you really stretch out those ligaments, due to them not having a rich blood supply, they can really be affected and they do not repair like other parts of the body. So we found an innovative way of treating these ligaments. That's with prolotherapy. So prolotherapy is a minimally invasive treatment used to treat ligamentous structures. We use lidocaine and dextrose solution. That dextrose solution stimulates the growth of blood into the area, helping with that healing factor. If we were able to strengthen those knees up, you will have a lot better results. Now, you probably try things like PRP. That's an intra-articular injection. If that's 50% of the problem and you do a PRP injection into the knee, you're only going to get 50% improvement as a maximum. What we found out is if we segregate that specific area of the knee that's causing the problem, whether it be on the inside, whether it be a combination of inside and outside, if we treat those areas, you will get much better results. And we've seen up to 95% of results from treating those areas. If your knee pain, on the other hand, is coming from inside the knee, in here, the best way we find that it's usually the cartilage that's affecting it. The best way we find this being treated is through prolozone. So what prolozone is, you've got ozone therapy infused with the prolotherapy. Ozone, O3, it's a rich form and a heavy, dense form of oxygen. Now, your body, as you may well know, has a rich need for oxygen. That's what helps with a lot of the healing structures. So if we inject ozone therapy into the knee, it starts to regenerate and increase the blood flow into that area. Now, prolozone, what you find is it's antifungal, antibacterial, but more importantly, anti-inflammatory. So if you're able to reduce the inflammation at the knee joint, you have a really good success rate in reducing the pain. Finally, if your knee pain is coming more from the soft tissue, whether it be the muscles or the tendons, hydrodissection may be the thing that works for you. Hydrodissection, think of it if you've got like a lot of inflammation, a lot of swelling into those soft tissue areas, or on the other side, if it's something chronic where you've got a lot of adhesion buildup, that's going to be likely to cause the pain. Hydrodissection simply means cutting away that fibrous tissue. So we'll get the needle, we'll go into that area using ultrasound scanning, and then we'll look to separate that. Now, the tissue is designed to glide within one another. If you've got a lot of those adhesions, or what we like to refer to as scar tissue, if we've got a lot of that adhesion buildup, then things do not like to slide, causing a lot of inflammation. If we start to separate that, you have a really good success rate. We can do that on the muscles in the front of the thigh, the back of the knee, the soft tissue and the tendons around the knee, and we have really good results with that. Lastly, the only thing is healing takes time. You need to give yourself time to heal. Whether it be a mild case where it's stage 1 or stage 2 of degeneration, we usually have really, really good results with these people. Stage 3, on the other hand, we tend to have good results, but it's a little bit harder. Once it goes into stage 4, I'm not saying that we don't help these people, we can help them, but it's a lot harder. Usually stage 4 is when you go into knee replacement territory. So if you've been told you need a knee replacement, and we found this in countless times, sometimes it's a grade 2 and you don't actually need that knee replacement. If we're able to help you out, let's see what we can do for you. So if you want to get in contact, go to our website, give us a call, send us a message. We'll be able to see if we can help you out. And we'll be honest with you, we'll see how much we can actually help out and if this is the right treatment for you.